Hi guys, I'm Dr. Meena. I'm a practicing family practice physician in United States, and I have this channel called Health and Wellbeing with Dr. Meena. In this channel, I try to explain your well-being and your health in a very easy, non-medical way for you to understand what different things are, what different diseases are, and how they are formed and how you can prevent them and be healthy. So let's get started. Our first topic here is hemorrhoids. You go to a doctor and the doctor says you have hemorrhoids, and it's like, what's hemorrhoid? They don't have time to explain in detail what hemorrhoids are, and they give you a paper or just say, hemorrhoids are, go and read it on web page. So let me explain what hemorrhoids are, how they are formed, what causes them, how you can prevent it, and what are some of the problems you can have because of hemorrhoids. So first of all, what are hemorrhoids? Hemorrhoids are veins. These are blood vessels in your last part of gut called rectum, and the opening from where the poop comes out is called anus. So heart has two blood vessels. The good clean blood goes from heart to the different tissues is called arteries, and vein is a blood vessel that brings the dirty blood or the bad blood that needs purification from the different tissues to your heart to be purified. So gut, the terminal part is called rectum, and from where the poop comes out is called anus. So let me draw and explain what hemorrhoids are. So if you cut me longitudinally in the middle, and we are cutting the gut from top, half this way and half back, this is what your gut is like, in a very rough way. This is the anus where the poop comes out, and in the rectum, we have three veins. These veins dilate at the lower part, and that is called hemorrhoids. These dilated veins part are called hemorrhoids. You can feel them out, or sometimes they start bleeding. So these dilated veins are at the terminal part of the gut or the anal part are called hemorrhoids. There are many causes of hemorrhoid, but the most common two causes of hemorrhoids are constipation and pressure. Constipation is when you have hard, small, pallet-like stools. You can have them every day or every third day. But they're hard, they're formed hard and pallet, and they're hard to pass out. It's not constipation if you have soft stool every fourth day. If you have soft stool, that's not constipation. Hard stools are constipation. What happens is, in constipation, the stool gets stuck here, and then the vein that comes up cannot pass because it's been pressed and blocked. So the terminal part of the vein dilates and causes hemorrhoids. Second part is if you put too much pressure. A lot of us are in the habit of going to the bathroom, sitting there, putting pressure to have a bowel movement. That is not healthy. All that pressure over time causes hemorrhoids. Sometimes we are in a hurry, sometimes we just want to sit down, have a bowel movement and move away. You should only go when you feel like you're having a pressure and you need to have a bowel movement, not just because it's the morning and you need to go. So you can prevent hemorrhoids by preventing constipation. How can you prevent constipation? 3 ways you can prevent constipation. One is high fiber diet, that can be vegetables and fruits and grains, eating large amount of it. If you can't eat those, then taking some over-the-counter fiber-forming drinks that you can put the powder in the water and drink, and they give you enough fiber to form a bulk. Second is drinking 3 to 5 glasses of water. And third is exercise. When you exercise, your gut move, and when your gut move, you have a bowel movement. Now, why constipation is formed? Because the water is absorbed and there is small amount of hard stools. To make these stools soft, you drink water. To have a bulk so they can pass, you take fiber. And exercise for the movement so they can pass out. Second is take high fiber diet, take stool softeners over the counter so you don't have hard stools and you have regular bowel movements, so you don't have to put pressure. So when you sit down, the stools come out comfortably without causing any pain or pressure. And you can prevent hemorrhoids from forming. Now, some of the problems of hemorrhoids, common problems, are anemia. If you have hemorrhoids for many months, 2 to 3 times a month, you have pressure, you have bleeding, and hemorrhoids are there, they're painful, that can cause anemia. Hemorrhoids can be painful. They also give you a feeling of fullness and pressure in your rectum, and you feel like you have to go all the time. When you go all the time, you're trying to pass stool, but they're not stool, they're hemorrhoids that giving the feeling of fullness in the rectum. So that pressure can cause rupture and bleeding. Also, one of the complications is called fissure. So this is your gut, and longitudinal slit in the skin inside the gut is fissure. This is inflamed part. So anytime you pass a bowel movement, it expands and that causes a lot of pain. There are ways to treat it so it doesn't get worse. And if it gets bad, fissures need surgeries. And you don't want to have surgery. So if you keep your diet healthy, high fiber, drink water, you can prevent hemorrhoids from forming, and you can prevent yourself from having complications like these. So let me know in your comments down what topics you want me to discuss and how did you find this video, if it was helpful or not. I'll be bringing more videos with information, something like anemias, constipation, and different other topics. So keep watching, guys. Bye.